If you've been drinking bone broth every single day hoping to fix your knee pain, your shoulder stiffness, or that constant ache in your lower back, but you're still waking up feeling like your joints are made of rusty hinges, then you need to hear what I'm about to tell you. Because there's a food that's been sitting in grocery stores this whole time, something our grandparents ate regularly, that delivers everything bone broth promises and more, but hardly anyone talks about it anymore. And the shocking part? It's probably 1/10 the price of those expensive bone broth containers you've been buying. My name is Dr. Susan Miller, and I'm a board-certified orthopedic surgeon who has spent the last 23 years working with patients struggling with joint pain, muscle weakness, and mobility issues. I've seen thousands of people come through my clinic desperate for relief, trying every supplement, every diet trend, every miracle cure they read about online. And I'm going to share with you today what I've learned from both my clinical experience and from patients who have made remarkable improvements in their joint and muscle health. Before we get started, if you haven't subscribed yet, I highly recommend hitting that subscribe button and turning on the notification bell so you never miss another health tip designed specifically for you. If you find this video helpful, please leave your questions and video suggestions in the comments below. I read every single one, and it helps me create more content to help more people just like you. Now, let me tell you about Señora Maria dos Santos, a 72-year-old retired teacher from Florianopolis who came to see me about 18 months ago. Maria had been drinking bone broth religiously for almost a year. She'd wake up at 5 in the morning, heat up her homemade broth, drink 2 full cups before breakfast. She did this every single day without fail. She'd read all the articles about collagen, about glycine, about how bone broth was the ancient secret to healthy joints. But when she walked into my office, she was still limping. She still couldn't kneel down to play with her grandchildren. She still woke up with stiff fingers that took an hour to loosen up. "Doutora," she told me with tears in her eyes, "I've done everything right. Why am I not getting better?" That's when I asked her about the rest of her diet, and that's when I discovered what was missing. Maria was so focused on drinking bone broth that she'd actually eliminated several foods from her diet, foods she used to eat when she was younger. One of those foods? Small fish eaten whole, bones and all, sardines, anchovies, small mackerel. She'd stopped eating them because she thought bone broth was the superior option. But here's what most people don't understand. When you eat small fish with their bones, you're not just getting collagen. You're getting a complete package of nutrients that work together in ways bone broth alone simply cannot provide. Let me explain the science here in a way that makes sense. Collagen is important, absolutely. It's the primary structural protein in your connective tissues, your cartilage, your tendons. But collagen doesn't work alone. It needs cofactors. It needs other nutrients to actually be synthesized and maintained in your body. Think of it like building a house. Collagen is like the wooden frame, but you also need nails, screws, insulation, electrical wiring. You need the complete package. When you eat small fish whole, with their tiny bones, their skin, their organs, you're getting calcium in a highly bioavailable form. You're getting vitamin D, which is essential for calcium absorption and also plays a role in reducing inflammation in joints. You're getting omega-3 fatty acids, specifically EPA and DHA, which are powerful anti-inflammatory compounds that can significantly reduce joint pain and stiffness. You're getting vitamin K2, which helps direct calcium into your bones and teeth instead of your soft tissues and arteries. You're getting phosphorus, magnesium, zinc, selenium. And yes, you're also getting collagen and gelatin from the bones, skin, and connective tissues of these small fish. It's a complete nutritional package that targets joint and muscle health from multiple angles simultaneously. I started Maria on a simple protocol. 3 times per week, she would eat a can of sardines or a small serving of fresh sardines or anchovies. She could have them on toast, mixed into a salad, mashed with olive oil and lemon juice, however she preferred. She continued drinking her bone broth if she wanted to, but I made sure she understood that these small fish were non-negotiable. Within 6 weeks, Maria came back to my office walking differently. The limp was less pronounced. "Dutora," she said, "I can kneel down now. I played on the floor with my grandson for 20 minutes yesterday. I haven't been able to do that in 3 years." By 3 months, her morning stiffness had reduced from over an hour to less than 15 minutes. She still had some arthritis. We couldn't reverse that completely, but her quality of life had dramatically improved. And the interesting thing? Her bone density scan, which we did at 6 months, showed improvement. Not massive, but measurable improvement. Her doctor was surprised, but I wasn't, because I'd seen this pattern before. If you're still watching and finding this information useful, comment 1 below to show me you're with me. Because what I'm about to share next is something that surprised even me when I first discovered it in my clinical practice. Let me tell you about Señor Carlos Alberto Ferreira, a 68-year-old former construction worker from Porto Alegre. Carlos came to me with severe knee osteoarthritis. He was taking anti-inflammatory medications daily, sometimes twice a day. His stomach was starting to have problems from all the medication. He was considering knee replacement surgery, but he was scared. His cousin had the surgery and had complications. Carlos was desperate for alternatives. He'd tried glucosamine, chondroitin, turmeric supplements, bone broth, everything he could find at the pharmacy or health food store. Some things helped a little, but nothing made a significant difference. His knees still swelled up after any physical activity. He couldn't walk more than 2 blocks without severe pain. His life had become very small. He'd stopped going to his weekly card games with friends because walking to their meeting place was too painful. He'd stopped going to church because sitting in the pews made his knees stiffen up so badly that standing afterwards was agony. His wife told me privately that she was worried about him because she could see him becoming depressed, withdrawing from life. When I reviewed Carlos's diet, I found something interesting. He was eating a lot of protein, which is good. Chicken, beef, some pork, but almost no fish. He didn't particularly like fish, he said. The smell bothered him, especially sardines. So I made a deal with him. I said, "Carlos, I want you to try something for just 8 weeks. That's less than 2 months. I want you to eat sardines 3 times per week. You can buy the canned ones in tomato sauce. That helps with the smell. You can mix them with rice and beans, make them into a paste with crackers, whatever works for you. But 3 times per week, without fail. Can you do that for 8 weeks?" He was skeptical. He didn't see how eating fish could possibly help his knees more than all the expensive supplements he'd already tried. But he agreed to try. The mechanism here is fascinating, and I want you to understand it because it explains why this works when so many other things don't. Osteoarthritis, the type of arthritis Carlos had, involves inflammation in the joint, breakdown of cartilage, and often changes in the bone underneath the cartilage. The omega-3 fatty acids in small fish, particularly EPA and DHA, are converted in your body into specialized pro-resolving mediators, compounds with long scientific names like resolvins and protectins. These compounds actively help resolve inflammation. They don't just block inflammation like anti-inflammatory drugs do. They actually help your body complete the inflammatory process and return to a healthy state. This is huge, because chronic inflammation in joints is one of the main drivers of pain and cartilage destruction. At the same time, the calcium, vitamin D, vitamin K2, and other minerals from the fish bones are supporting bone health. Remember, in osteoarthritis, the bone under the cartilage undergoes changes too. Supporting overall bone health can slow this process. The protein from the fish provides amino acids that are building blocks for cartilage repair. And the collagen from the skin and bones provides the specific amino acids, glycine and proline in particular, that are abundant in cartilage. Carlos came back after 4 weeks. He said he hadn't noticed much change yet, but he was sticking with it. I encouraged him to continue. After 8 weeks, he came back with a different look on his face. "Dutora," he said, I don't know if it's the fish or if it's just in my head, but my knees feel different. They still hurt, but it's less sharp, more dull. And they're not swelling as much after I walk. I measured his knee circumference. The swelling had indeed decreased. His range of motion had improved slightly. Keep going, I told him. After 6 months on this protocol, along with some physical therapy exercises I'd prescribed, Carlos had reduced his anti-inflammatory medication from twice daily to only as needed, maybe 3 or 4 times per week. His stomach problems had resolved. More importantly, he'd started going back to his card games. He'd returned to church. His wife said he was like a different person, more engaged, happier. The fish hadn't cured his arthritis. Let me be very clear about that. He still had osteoarthritis, but they had significantly reduced his inflammation, supported his joint health, and improved his quality of life to the point where he could participate in activities that mattered to him. Now, some of you might be thinking, but Dr. Miller, I don't have arthritis. My joints are just a bit stiff sometimes, or my muscles feel weak. Is this relevant for me? The answer is absolutely yes. Let me tell you about Señora Patricia Almeida Rocha, a 61-year-old yoga instructor from Curitiba. Patricia didn't have arthritis. She'd been active her whole life. But she came to me because she'd noticed something troubling over the past couple of years. She was losing muscle mass, her muscles felt weaker, and she was recovering more slowly from her yoga practice. She'd always been able to hold difficult poses to demonstrate for her students. But now she was struggling. Her balance wasn't as good. She felt less stable in one-legged poses. She was tired more often. I know I'm getting older, she told me, but I'm only 61. I shouldn't be declining this fast, should I? This is a condition called sarcopenia, age-related muscle loss. It's incredibly common, and it starts earlier than most people think. After age 30, you start losing muscle mass at a rate of about 3 to 8% per decade. After age 60, this accelerates. The consequences go beyond just feeling weaker. Loss of muscle mass is associated with increased risk of falls, decreased metabolic rate, reduced bone density, loss of independence, and even increased mortality. It's serious. Patricia was eating a vegetarian diet, which can be very healthy, but she wasn't getting enough complete protein, and she was getting almost no omega-3 fatty acids, except from the occasional walnuts and flax seeds. But here's the thing about plant-based omega-3s. Your body has to convert them from ALA to EPA and DHA, and this conversion is very inefficient, often less than 10%. So even though Patricia thought she was getting enough omega-3s, she really wasn't getting enough of the forms her body needed. I had a frank conversation with Patricia about this. I respect vegetarian and vegan choices, but I also have to be honest about nutritional needs, especially as we age. I explained that the omega-3 fatty acids in fish are not just about inflammation. They also play a crucial role in muscle protein synthesis, the process by which your body builds and maintains muscle. Studies have shown that omega-3 supplementation can enhance the muscle protein synthesis response to both protein feeding and exercise. This means that when you consume protein after exercise, if you also have adequate omega-3 levels, your muscles are better able to use that protein to repair and grow. Additionally, omega-3s may help reduce muscle protein breakdown. They're working both sides of the equation, increasing synthesis and decreasing breakdown. Patricia decided to make an exception to her vegetarian diet for sardines and anchovies. She wasn't comfortable with this emotionally at first, but she was more uncomfortable with the idea of continuing to lose strength and independence. She started eating sardines 3 times per week, and she also increased her overall protein intake from plant sources like legumes and quinoa. I also had her working with a physical therapist on a structured strength training program, because diet alone isn't enough. You need the stimulus of resistance exercise to build muscle, but the nutrition was the foundation. After 3 months, Patricia's grip strength had increased measurably. This is important because grip strength is actually a good indicator of overall muscle health and even longevity. Her balance had improved, She felt more energetic. By 6 months, she told me she felt like she'd gone back in time about 5 years. She could hold her advanced poses again. She was demonstrating more. Her students, who are mostly older adults themselves, noticed the change in her and started asking what she was doing differently. Some of them have now adopted similar dietary changes. Patricia's story is important because it shows that even if you don't have joint pain or obvious problems, supporting your musculoskeletal health proactively, especially as you age, can prevent decline and actually improve your function. But if this surprises you, wait until you hear about what happened with my patient, Señor Juan Pedro Oliveira. Juan Pedro was 79 years old, a retired accountant from Belo Horizonte. He came to me not because of his joints, but because his primary care doctor was concerned about his bone density. João had osteoporosis, thinning of the bones, which put him at high risk for fractures. He'd already had a wrist fracture from a minor fall 2 years earlier. His doctor had prescribed him medication for osteoporosis, which he was taking, but João was worried. His mother had died from complications after a hip fracture when she was 83. He didn't want to follow that same path. He was asking me if there was anything else he could do beyond just taking his medication. Here's what most people don't realize about bone health. Your bones are living tissue. They're constantly being broken down and rebuilt in a process called remodeling. In osteoporosis, the breakdown is happening faster than the rebuilding. To support rebuilding, you need the raw materials. Calcium is important, yes, but it's not the only thing. You need vitamin D to absorb the calcium. You need vitamin K2 to direct the calcium into your bones. You need magnesium, which is involved in converting vitamin D to its active form and also in bone crystal formation. You need protein, because bone is not just minerals, it's about 30% protein, mainly collagen. You need trace minerals like zinc and copper and manganese. And emerging research suggests that omega-3 fatty acids may also play a role in bone health by reducing inflammation that can accelerate bone loss. When I looked at João Pedro's diet, he was taking a calcium supplement, which was good. He was taking vitamin D, also good. But the rest of his diet was quite poor in the nutrients I just mentioned. He ate mostly rice, beans, bread, some chicken. Very little fish, no sardines or small fish. I explained to him that his bones needed more than just calcium and vitamin D pills. They needed a complete package of nutrients, preferably from food sources where these nutrients come together naturally in the right ratios. I put João Pedro on a protocol that included sardines 4 times per week, more frequent than some of my other patients because his bone health was already compromised and we needed to be more aggressive. He was also taking his prescribed osteoporosis medication, doing weight-bearing exercise as approved by his doctor, and we optimized his vitamin D levels with appropriate supplementation. After 6 months, his bone density scan showed improvement. Not dramatic. Osteoporosis doesn't reverse quickly, but measurable improvement. More importantly, he hadn't had any more fractures. He felt steadier on his feet. He was less afraid of falling, and that psychological change meant he was actually moving more, which further helped his bones. João Pedro is now 81, and he's still doing well. He tells everyone he knows about his sardines. "They saved my bones," he says. I'm not sure I'd go quite that far. The medication and exercise were also important, but the nutritional support from the fish was definitely a crucial part of his improvement. I want to pause here and address something important. Some of you might be thinking about mercury in fish, about sustainability, about cost. These are valid concerns, so let me address them. Small fish like sardines, anchovies, and small mackerel are at the bottom of the food chain. They don't accumulate significant amounts of mercury the way large predatory fish like tuna and swordfish do. They're actually among the safest fish to eat regularly from a mercury standpoint. In terms of sustainability, sardines and anchovies are generally well-managed fisheries and are considered a sustainable choice. Check for certifications if this is important to you. As for cost, canned sardines are actually one of the most affordable sources of high-quality protein and nutrients you can buy. In most places, you can get a can of sardines for less than the price of a coffee. Compare that to bone broth, which can cost $10 to $15 for a container that lasts a few days. The economics actually favor sardines strongly. Let me share one more case with you, and this one really illustrates the power of addressing muscle and joint health comprehensively. Senora Beatriz Lima Costa, a 73-year-old former seamstress from Salvador, came to me with multiple problems. She had osteoarthritis in her hands, making it difficult for her to do detailed work. She had chronic shoulder pain from decades of repetitive motion. She had weak legs and poor balance, which made her afraid of falling. She'd already fallen once in her bathroom and had been lucky to escape with just bruises. She was taking several medications for pain. She was discouraged, feeling like her body was just falling apart, and there was nothing she could do about it. "I feel like I'm just waiting to break," she told me. That phrase has stuck with me. Waiting to break. Beatriz's case required a multifaceted approach. We couldn't just address one issue. We needed to think about inflammation, bone health, muscle strength, nutrition, exercise, everything. I worked with her primary care doctor, a physical therapist, and a nutritionist, but a key component was adding sardines to her diet 3 to 4 times per week. She'd never been a big fish eater, but she was willing to try. She found that she actually liked canned sardines in olive oil mixed with lemon juice and served on crackers or toast. It became one of her regular snacks. Over the course of a year, Beatriz's transformation was remarkable. Her hand pain decreased significantly. She was able to do more detailed work with her hands. She took up doing small embroidery projects, something she hadn't been able to do in years. Her shoulder pain improved with physical therapy and the anti-inflammatory effects of the omega-3s. Her balance improved dramatically with strength training and better nutrition supporting her muscles. At her 1-year follow-up, she told me, "Doutora, I don't feel like I'm waiting to break anymore. I feel like I'm living again." That's the difference comprehensive musculoskeletal care can make. And the sardines, that simple, inexpensive food, was a crucial part of providing her body with the nutrients it needed to heal and strengthen. Now, I want to make sure you understand exactly how to implement this. First, frequency matters. Aim for at least 3 times per week, more if you have significant joint problems or are at risk for osteoporosis. Second, variety is good but not essential. Sardines, anchovies, small mackerel, herring. These are all excellent choices. Even canned salmon with the bones is good, though it's slightly larger fish. Third, eat them whole, or at least eat the bones if they're soft. That's where much of the calcium and other minerals are concentrated. Fourth, don't overcomplicate it. You don't need fancy recipes. Canned sardines straight from the can, maybe with a squeeze of lemon, maybe on toast, maybe mixed into a salad, that's perfectly fine. Fifth, consistency is more important than perfection. If you miss a day, don't worry about it. Just continue with your regular schedule. Some practical tips. If you don't like the smell or taste of sardines, try them in tomato sauce first. That masks the fishiness. Try different brands. They can vary significantly in taste and texture. Add them to foods you already like pasta or rice dishes. The flavor gets distributed and is less intense. If you really cannot tolerate sardines, you can try other small fish, or as an alternative, fish oil supplements can provide the omega-3s, though you'll miss out on the calcium, vitamin D, protein, and other nutrients. Bone broth can still be part of your routine if you enjoy it, but it shouldn't be your only strategy. Think of it as one tool in your toolbox, not the entire toolbox. I also want to address some common mistakes I see people make. First mistake, eating fish once in a while and expecting dramatic results. This needs to be regular, at least 3 times per week. Second mistake, buying expensive supplements instead of eating actual fish. While supplements have their place, whole foods provide nutrients in a form and combination that's often more beneficial than isolated supplements. Third mistake, eating large fish like tuna regularly and thinking that's the same. Large predatory fish don't have the same nutrient profile as small whole fish, and they have mercury concerns. Fourth mistake, removing the bones from canned fish. Those soft bones are edible and nutritious. Don't discard them. Fifth mistake, not combining this dietary change with other healthy habits. You still need adequate protein from various sources. You still need fruits and vegetables. You still need to exercise. You still need adequate sleep and stress management. Sardines are powerful, but they're not magic. They work best as part of an overall healthy lifestyle. Let me give you a very specific action plan you can start today. This week, go to your grocery store and buy 3 cans of sardines. Choose different varieties if you want. Maybe 1 in olive oil, 1 in tomato sauce, 1 in water. Try them and see which you prefer. Schedule 3 days this week where you'll eat 1 can. Put it on your calendar if that helps. Next week, do the same thing. Make this a habit for the next 8 weeks. Keep a simple journal if you want. Note any changes in joint pain, stiffness, energy levels, muscle strength. After 8 weeks, evaluate. I predict you'll notice improvements, maybe subtle at first, but real. If you have a healthcare provider managing chronic joint issues or osteoporosis, let them know what you're doing. They may want to do some measurements to track your progress objectively. I've spent over 2 decades helping people improve their musculoskeletal health, and I can tell you that while there are no miracle cures, there are definitely strategies that work significantly better than others. Small fish eaten whole is one of those strategies. It's not sexy, it's not a trendy supplement with fancy marketing, it's not expensive, but it works. It provides a comprehensive package of nutrients that target joint health, muscle health, and bone health from multiple angles simultaneously. The anti-inflammatory omega-3s reduce pain and support muscle function. The calcium, vitamin D, and vitamin K2 support bone density. The protein provides building blocks for muscle and connective tissue. The collagen supports cartilage health. It all works together. If you're dealing with joint pain, muscle weakness, or bone density concerns, I encourage you to have a conversation with your healthcare provider about incorporating small, whole fish into your diet regularly. Show them this information if it's helpful. Get their input, especially if you're on medications or have other health conditions, but don't wait for perfect circumstances. Start where you are. Buy those sardines this week. Your joints, your muscles, your bones, they'll thank you. And months from now, when you're moving better, feeling stronger, living with less pain, you'll be glad you took this simple step. Remember, you're not waiting to break. You're choosing to build. You're choosing to strengthen. You're choosing to support your body with the nutrients it actually needs. Thank you for watching this video all the way through. If you found this information valuable, please hit the like button, leave a comment with your questions or experiences, and share this video with anyone who might benefit from this information. Your engagement helps this content reach more people who need it. And remember, always consult with your healthcare provider before making significant changes to your diet or treatment plan. What works well for one person may need to be adjusted for another based on individual health conditions and circumstances. Take care of yourselves, and I'll see you in the next video where we'll discuss more strategies for healthy aging and optimal musculoskeletal function.